Hello, FARF community. I'm Megan Voss, and I was invited to be here today to talk with you about our survivorship project that we're working on. And I've asked my colleague, Maureen Anderson, to join me today to share with you all the exciting work that we've been doing.
Hello, thank you so much for having me. It's wonderful to be here today and included in this incredible work.
So we'll be sharing with you a resource we've spent the last several years creating called Taking Charge of Your Survivorship. This is a resource designed for adolescents and young adults who are living with cancer, Fanconi anemia, or any number of rare genetic conditions. I think it's important that we take a moment to define survivorship together. I've heard from some people living with Fanconi anemia that the term survivorship is a little confusing to them or isn't a term you might be used to using in your daily life. So the term originally came from the oncology world. Many people diagnosed with cancer use the term survivorship to define the period of living with cancer. And we think that that term can expand and encompass the journey that you go through living with Fanconi anemia as well. So we draw our definition of survivorship from many sources and from our own experience working with people like yourselves. We like to think that survivorship begins at the time of diagnosis and encompasses the whole journey that you go through various ups and downs and phases of treatment and recovery. We know that survivorship affects both people living with cancer and those living with other chronic illnesses and other life challenges. It is a constant set of ups and downs. It's not one state, it's ever changing, and the challenges throughout the survivorship phase are ever changing as well. Therefore, we have worked to design resources to meet you at every phase in your survivorship journey. And we also acknowledge that it is indeed a journey and not a state of being cured or moving on, but really a state of living in harmony with the diagnosis that you have. As I mentioned before, our website is really aimed at adolescents, young adults, and their family caregivers. So we spent time with our key audience in developing this resource to understand the needs of the people who fall into these categories. So we talked with cancer survivors, those that are living with solid tumors and blood cancers. We know that there are an abundance of resources that exist for cancer survivors. We also know that a lot of those resources focus on the physical symptoms and the long-term medical care planning that's needed to live with cancer. But not all survivorship programs have much of a focus on psychosocial, emotional, or mental well-being. And we also know that adolescents and young adults often fall between the cracks because many programs are either really good at tending to the needs of younger children and pediatrics, or they're really good at tending to the needs of older adults. But those who are just coming into young adulthood or teenagers don't always feel like they have a great community to support them. And then we talked to a lot of people living with rare genetic disorders. We talked with many people living with Fanconi anemia and other disorders. And we learned that many centers that, medical centers that may be in your area don't have resources to meet the unique needs of individuals living with rare diseases. Your communities are small, they're diverse, and you're very geographically spread out. And so we know that you rely on this type of virtual connection to find your people and your sense of community. And that was part of the reason it was important to us to design resources that could reach you in whatever state that you're in. We had a lot of experience working with people with Fanconi anemia when they came to our transplant center. And so we got to be a part of that important snapshot of their treatment. But then they would go back to their home states of Wisconsin and Michigan and New York, and we weren't able to meet their needs as well or stay as connected with them. And so we wanted to have an online resource that could sort of transcend those barriers of physical distance. And you'll see today what we discussed. We primarily are at the stage of offering unidirectional resources that you can access when you go back home. But we're really looking at how can we create an interactive community where you can reach out and get the help that you need from anywhere in the United States and ultimately in the world. And then we wanted to importantly create space and resources for family caregivers, because we know how important family caregivers are to anyone living with any condition. And certainly in the FA community, we see and we honor family caregivers. And so in the words of one of your beloved community members, Allison Brenninger, we like to highlight those important people in the negative space, the parents, the grandparents, the siblings, and the spouses who really hold it all together and fill in the gaps between the physical health care and the mental health care and all the appointments and medications. So we didn't want to forget caregivers as we built resources to meet the needs of this community. We pulled together a list of challenges that survivors face, and these are based on what the National Institute for Health has put out as the list of challenges that survivors face. So these are mostly specific to cancer survivors, but as we looked at this list, we thought there's not much on here that doesn't also apply to those living with Fanconi anemia. And certainly we recognize that many members of this community have faced cancer diagnoses as well. So there's of course always the risk of reoccurrence, or sometimes in the case of FA, the risk of just finding a new cancer. There is certainly impacts on your quality of life. For those of you who have been through a lot of treatment and certainly transplant, there's many challenges and physical side effects that go along with that. But then, we do a good job of talking about the treatment side effects and the physical challenges that come along with the diseases. We don't talk a lot about the emotional distress and the mental toll that treatments and diagnosis have on your everyday lives and the impact they have on your quality of life. We don't do a great job of talking about things like loss of fertility or diminished reproductive health, but we know that those are important challenges that this community is facing, as well as things like financial burden and interruption to your education or to your employment or career longevity. There's also, of course, all the other challenges, frustrations, barriers that come along with our healthcare system. And certainly those of you that are joining us from other countries, you may have different but similar challenges that you would add to this list as well. So I'm going to hand it to Mo to talk with us a bit about the ways in which the website aims to kind of provide resources and tackle some of those gaps that we just discussed.
Yes, thank you so much, Megan. So as Megan talked about, some of those challenges that the survivorship community faces are similar challenges to what members of the FA community experience as well. And throughout these conversations that we had with caregivers, with survivors themselves and patients in the acute treatment phase, really 5 main themes started to emerge. And those themes really serve as a guide now for the entire Taking Charge of Your Survivorship website. So those themes that emerge are well-being. So that's the physical and mental health components of well-being. Transitions. These could be transitions through from the hospital setting to home, maybe from the school environment or the work environment back into whatever life experience you might be in, whether that be back into your work, your school, and back and forth, and how to communicate those transitions to those around you, whether that be friends who you are in contact with who just don't understand necessarily what you've been exposed to. So we have these conversation toolkits about those transitions. Another theme that emerged was integrative therapies. So for those of you who maybe have worked with Megan and I in the hospital or in the clinic setting, you know that we're both specialized in integrative therapies. And this is to serve as a continuation of the care that was received on the inpatient side and to provide information to people about what is relevant, what is reliable information, and what is safe to practice. A lot of the resources surrounding integrative therapies aren't necessarily, actually, most of them aren't geared towards individuals who have chronic disease, who are going through active treatments, who have maybe had a bone marrow transplant. And really, those integrative therapies have special considerations to consider. And so that's what we do on this site is we just help people tune in to what are those special considerations and how to read and use information that you find on the internet or through conversations with others that is really safe to be able to practice. And then furthermore, how to start having those conversations with your care team. So we recognize that many individuals that we work with aren't actually part of our local community and are going back to other care centers and are going back to other medical facilities, and how to start talking about integrative therapies and how to start incorporating those into their care practice as well. Next, there's support, and we'll show a little bit more about this section later on, but this is really where we intend to continue to build out on what is the support of the community. So this might be support for survivors and navigating conversations among peers and among survivors themselves, but then also how to share your story. We've heard from many individuals that there's a sense of therapeutic relief in talking about your story, sharing your experience, and reading about others who have a shared experience. And so we have provided a space to be able to facilitate that for individuals. And then lastly, we heard time and time again that there really needs to be resources and content developed for the caregivers within these communities as well. Not only were we hearing this from the caregivers themselves of saying, I need to know how to have these conversations, I need to be part of the story, but we are also hearing it from survivors and patients themselves saying, I want something more for the caregivers in my life. I see how much they put in. I see how much work this is. I see what they have to do, and I want them to be acknowledged as well. So we provide resources in there for the caregivers as well. So why this content? Why this platform? And how did we come here? So throughout the development, as Megan said, this has really been a 2+ year project that we've been on. And we really wanted it to be reliable, but we really wanted it to be realistic for the individuals who would be using it. So we spent a lot of time listening. You talked and we listened. We wanted this to be a place for people to connect with others who have gone through extensive treatments themselves and who could kind of have a space with those shared experiences. It was designed by survivors and designed for survivors. So what this means is we really collaborated with other survivors, individuals within the cancer community, many individuals within the FA community, and other diagnoses communities as well. But we really worked with these individuals to say, what's meaningful for you? What do you want to see on this site? And this helped tailor all of the content. This is really what drove all the content, so that it was a place that someone would go to and say, this feels like home. This feels like a safe space for me. This feels like someone understands what I've gone through. We really wanted something that was accessible, free, reliable, and safe. So this was a major priority for us because it was so important for us to provide unlimited access for individuals, because we know that so many individuals, as Megan said, are across the nation. We have international patients that we work with. We wanted to touch and reach survivors that we don't work with even. So everyone could really come here and find reliable information on a site that not only felt, okay, this is reliable, this is evidence-based information, but this also feels like a digestible. It doesn't feel cold. It doesn't feel like a unilateral space. It feels like someone that really understands what I've gone through on the mental and the emotional side. And then this site is growing and changing every single week based on conversations and feedback that we get from users, based on interviews that we're having with subject matter experts. We are really trying to make this a website that continues to evolve. We don't want it to be a stagnant website that doesn't continue to produce information and meet the needs of individuals who are using it, but we do want it to continue to evolve based on the feedback that we receive. So this is just a very brief snapshot. As I mentioned, we'll go into the website in a little bit closer to the end to actually show you what it looks like. But this is just to give you a visual of kind of what the site starts to look like. You can tell just by this image that this doesn't look like your standard healthcare website, your standard university-based website, but we really want it to feel like something, okay, this is a site I can go to, I can be interactive with. I don't just want to go to once for a single piece of information, but I want to keep coming back to it. I want to continue to see where it evolves and goes to. So a few examples of the content areas that you'll see throughout the site. We really did want to focus on establishing a sense of purpose and well-being. So there's resources for living a full, meaningful life, not just surviving the physical impacts of illness. We've heard from so many individuals who have gone through various types of treatment, or just individuals who are living with a chronic disease who have said, I don't necessarily feel supported. I know what to do when I'm actively in treatment, but I'm not sure what to do when I'm waiting for something else to happen, or I'm not quite sure what to do next. And what this site does a good job as is it helps individuals learn to navigate kind of that murky water space. That space of, I'm not quite sure what my sense of purpose is, and I'm not quite sure how well-being applies to me. And I think the site gives those tools and starts those conversations to allow people to say, okay, this is what's meaningful to me. This is how can I have a sense of purpose while also living with this condition? The site also addresses specific aspects of kind of those physical symptoms or those physical side effects. An example of this is we have an in-depth conversation of acute and chronic pain. What's unique about this section too, and what we've tried to do is we kind of provide the evidence, we provide the general overview of the content, but then we also give and embed conversations in there. Within this section, we have a conversation with an expert about what is meaningful, someone who deals with chronic pain a lot. What is a meaningful conversation with your care provider? Kind of how can you start paying attention to your pain in new ways to communicate how that pain is impacting you, whether it be acute or chronic, and different things to look out for, and how to kind of recognize and start to accept and understand the pain that you are in, and maybe the pain that you hope to have, or the lack of pain that you hope to have. And lastly, mood and anxiety challenges. I want to talk about this a little bit in the sense of this toxic positivity that we've seen kind of raising awareness about what this toxic positivity. Oftentimes, people who are either survivors or who are living with a chronic disease will hear things like, everything happens for a reason. You're only given what you can handle. These are well-meaning intentions, but they oftentimes create a state of anxiety or a state of frustration and lay bio mood. And so what we do on the site is really try to establish and say, those are valid feelings to be frustrated. Anxiety is a normal part of this. And here's how to help start managing and coping with some of those side effects and symptoms. So mental pain is less dramatic than physical pain, but it is more common and also more hard to bear. The frequent attempt to conceal mental pain increases the burden. It is easier to say, my tooth is aching, than it is to say, my heart is broken. This quote really just emphasizes and captures the essence of what this site, what taking charge of your survivorship is meant to be. It's meant to help people start the conversations and have those conversations of, I am having these physical symptoms, and this is how they're impacting me. This is how this process is impacting me, and how do I connect with others who have had this shared experience? So taking charge of your survivorship, Again, the essence of it is really to capture the importance of whole person care and recognizing that within each of the communities that we talk about through survivorship, whether it be the FA community, an individual who is going through cancer, it's really to recognize that the person behind that is a whole person. And that whole person needs to be acknowledged when they're going through any type of care and receiving care, because that whole person really matters in those decisions and in that process. So what this site does is it really works to bridge the gap between that medical and mental health care, saying that these two are inseparable and we need to do a better job in the healthcare industry to bridge that gap and to say that these are equally important components. By listening to adolescents and young adults living with cancer, FA, and other chronic diseases, we've learned just how much mental health is impacted by the treatment. We're working really hard to build more interactive resources that focus on this area. We have a lot of information and content in there as well for self-care. Now, I recognize in saying self-care, some people have already tried to tune out. It can be an overwhelming concept, and when we have lived such busy lives, the concept of self-care can be really overwhelming and demanding, especially if you are living in a state with chronic disease. Maybe you're in an active treatment stage, whether an active treatment stage within FA or going through BMT or working with the cancer diagnosis. Self-care can feel really overwhelming when you're already just trying to get through a new diagnosis as well. But what we do on this site is we really talk a lot about lifestyle changes, small and incremental changes that you can make on your daily life to make meaningful change, and what that self-care looks like. There's concepts. We talk a lot about vitamins and supplements and what's safe and what's not safe, what's necessary and what's not. And then how to start having conversations about mental health care and medical treatments and how to start navigating those conversations, because even just feeling empowered in your own healthcare is a sense of self-care. You're taking ownership of yourself, and this site is there to help provide those resources and also to empower you to do so. At this point, I will hand it over to Megan Voss.
So in a moment, we're going to jump on the website and show you a little bit about what it looks like. But we want to leave you with some ideas of how you might actually engage in the website before you get to take a look at the website itself. So we hope that you'll explore the website. We welcome all of you to contribute to the website. We've had many members of the FA community already contribute, and I think you'll see some friendly faces that you recognize when you get to the website. But we hope that you'll explore it. You'll consider contributing to it and giving us feedback on how we can make it better and more able to meet your needs. We have a section on the website that Mo's going to show you in a bit called Share Your Story. And we invite anyone who wants to talk a bit about their experience, whether it's their whole story or a snippet of their story, to give others who are embarking on this journey a sense of what it's like, a sense of realness, authenticity, a sense of hope, and a sense of connectedness for having a shared journey. So we'll show you how you can engage in that. We also hope that you share this resource with others, both within this community and in your broader community. So even if someone doesn't have FA or cancer, they may have a mental health struggle and they may find resources on our website. So share snippets of content where you see fit. We have started a hashtag for our content, and when we are sharing through our social media accounts, we've been using this hashtag. You can also follow Mo and I. We have professional accounts where we're sharing little snippets and pieces of the website from time to time. And then we ask you to just stay tuned as we continue this work. We, though we've been working on this already for a couple of years, we consider this the very beginning, early phases. In fact, the website launched a little before it was even done because COVID happened and we knew that people were in their homes and needing resources and needing to feel connected. And so we put content up and we opened it before we had developed everything. But we know this is only phase one. This is just giving you some information. We hope to think of creative ways to bring all of you and others together to form community. We hope that this can someday be a place where you could go if you have questions and you need to reach out. If you've been with us at our transplant center and you go home and you're struggling with depression, we want you to be able to go to the website and have it as a place where you can reach out and you can get the support you need, and not just in the form of an article, but in the form of real support and familiar faces and the level of mental health or medical help that you need. So there's a lot of growth to come. So please stay tuned. And we continue to work with FARF to better understand the quality of life issues that are facing this community. And so there may be upcoming opportunities for you to help us learn more from you. I know a lot of you have already given us your time and your input, and we're so grateful for that. And we hope to grow that input so that this website represents the voice of many and not just the few. So on that note, I will give a special thank you to our core team of the FA community that has given us a ton of input, that has shared their stories that appear in photography and videography throughout the website. The people on this list have shared their time and their talents with us, and we are so grateful because we couldn't have created this website without them. And I hope that this list grows and grows. But at this point, special shout out to Kyle Tanner, Angela Bedoya, Jasmine Bennetson, Mary Beth Johnson, and of course, the lovely Brenninger family. You've all contributed, and everyone who's been through our transplant center at the University of Minnesota and worked with Mo and I, whether it was for one day or many years, you've all made an impact on us and enabled us to be able to understand a tiny piece of what you live with and begin to formulate ways that we can increase your quality of life and break down barriers for you and support you in important and meaningful ways. So we're grateful to all of you. So with that, I'm going to transition to the website so we can walk you through. I'm leaving you here with our names and our email address. We have an email address dedicated specifically to this website, so you can send us feedback, questions, your story, anything you like at this website. Mo and I are the ones who check it, so it's not going to an admin or a box that's not monitored. It's us on the other side of this email, so please do reach out. All right, so here's a look at the website homepage. I'm going to walk you through a few of the menu items and some content that we want to feature, and then Mo will walk you through the share your story feature. So Mo's already talked with you about the 5 content areas on the menu. And so I'll just show you the way that we have broken it down. So we talk about well-being as the physical aspects of well-being, and then the mental and kind of emotional aspects of well-being. So in each of these areas, you'll find articles related to the topic at hand, articles that both validate your experience, give you ideas for talking with your healthcare team, and ideas for managing these conditions and symptoms at home. Transitions is a section we're really working on building up. So much more to come in this section, but when we met with people from your community and other cancer survivors, we learned that transitions were a really hard part of having a diagnosis, transitioning through different periods of the diagnosis, through different periods of treatment, to transplant, to home, to different phases of life. And so we're creating a lot of toolkits to help with these various transitions. Mo talked a lot about integrative therapy sections. So each of these sections, again, have videos and ideas, things you can do at home. They would make you aware of any risk factors or things that wouldn't be safe for you to partake in with a diagnosis like cancer or FA, and give you ideas for how to learn more. Then the support section is where we connect to our social media and our community organizations. So you'll see FARF is featured in that section along with other disease-specific community organizations. And then our caregiver section is another section that's growing every day, but you can see there's things for everyone in the family under the caregiver section. So one of the areas I wanted to highlight is an area we call conversation toolkits. And this is an area that Allison Berninger has been helping us with. We know that sometimes one of the hardest parts of having a diagnosis is that not a lot of people in your everyday life understand what you're going through, and which is part of what makes the FARF community such a safe place, because everyone there has an understanding of what it's like to have this diagnosis. But sometimes you need to talk to other people about what you're going through, and it's hard to find the words. And so we have, with the help of Allison and others, we have developed conversation toolkits, which contain the words. So the idea being, if you're experiencing something like loneliness and you're not feeling supported, you could send your friends and family a link to the website. You could read through it yourself and get some ideas of the words you might say. You could give your friends and family ideas of how you need to be supported. So hopefully things like this will serve as a bridge and take some of the burden off of you for having to express ways to get your needs met by us having formulated some of that for you. So this is an area that's set to be more developed. So if you have ideas for the types of conversation toolkits that would be useful, please send us your ideas because we want to develop the content that's most useful to all of you. And so with that, Mo, you can direct me to where you'd like me to go next.
Yeah, so there's actually two ways to get to the share your story section. So you can go right to the main page, and I'll have Megan show this way. You can go right here. The other section, as you can see it, the support section at the top in the menu was highlighted. It's just right within there too. You can click on share your stories. But we've heard from many individuals who are in the survivorship community that sharing their stories and reading other people's stories was really beneficial. It created a sense of community, making people not feel so alone in what they're going through. So this is to really provide people the option to read other people's stories, but then to share their own. So this is where you can send us a message. This goes directly to that email that Megan shared earlier. And you can either send us a message in here saying, I would like to share my story with you, or you can type your story directly in there, whichever one you want. We will be able to get back to you that way. Megan, if you continue to scroll down, we have a couple areas within here. And Megan, before you click on those, I do just want to give a general overview of what these are. So within the section called individual stories, this is where you will read stories from others who are either part of the FA community, maybe individuals who have gone through a blood and marrow transplant, maybe individuals who were recently diagnosed, or individuals who were diagnosed 15 to 20 years ago and what their journey has been like. So it's really to give a full spectrum of individuals who have similar shared experiences. Then we thought that by supporting this individual stories and story sharing, to give you some guides on journaling and provide some guided journaling practices of what this would look like. There's a significant amount of evidence to say that just the practice of journaling, whether learning to express yourself, writing out those thoughts, feelings, emotions, experiences, even if there's no intention of sharing what was written, the act of journaling can be therapeutic in and of itself and can help bring clarity when maybe feeling a little lost. So Megan, if you'll click into the individual stories. Like much of what we've said today, you'll see these continue to develop, but Megan, you can click right into Steve's story. So Steve is an individual who was diagnosed with cancer and received a blood and marrow transplant. And a couple of years back in June of 2016. But I love the quote that he said that, while doctors saved my body, I maintained my identity through several coping strategies. I practiced mindfulness, meditation, and yoga. I did lots of exercise. I maintained my sense of humor throughout. And Steve really did a good job journaling and writing his story. And he actually has a published book and talks a little bit about that as well, about his story. But this is just one way for him to connect with individuals who are going through a similar shared experience. So if this interests you, we would love to hear your story. We do ask that if you share it with us, can we share it with the community as well and post it on the site. So if that interests you, we'd love for you to contribute, but we also welcome you to come back to this space and read other stories that are continued to be developed. So with that, Megan, are there any other sections that you would like to go through?
I think you did a great job.
Well, at that, we just want to say thank you all so much for asking us to be here today, for taking interest in the Taking Charge of Your Survivorship website. You inspire us, your entire community, you as individuals, you inspire us to do the work that we do, to continue to show up every day and continue to develop content and do our best job to work with the communities and better serve you guys so that you feel safe, you feel cared for, and you feel acknowledged and heard. With that, we'd like to open it up to conversations and to any questions that you may have. Thank you.
Yeah, thank you all.